I want to update you on the latest coronavirus data and the vaccine rollout. In the last week in the UK, we have seen 37,258 cases of coronavirus on average each day. The NHS is under intense pressure across all parts of the country, with 37,899 people in UK hospitals with Covid-19, and that includes 4,076 people on ventilators. Sadly, today, 592 more deaths were reported. And we must never forget the real impact of this disease. The loved ones that we've lost, grandparents, parents, friends, colleagues. We grieve for each one. And the pressure on the front line, I can tell you, is just so relentless. And when I talk to colleagues who are working in the COVID wards, they are flat out and they are stretched to the limit. They're doing everything they can. And I want to say a huge thank you to all those colleagues who are working so hard. They're pulling a huge shift, and it's a duty on all of us to support them. I want to extend that thanks also to our ambulance workers. And in particular, I want to thank ambulance service staff who stepped up over the weekend when an appeal went out from the Scottish Ambulance Service for extra help, and ambulance services from the other nations have stepped forward. Our health systems across the UK routinely work closely together, offering support when it's needed, and from vaccines to ambulance services, we are stronger together. And the UK is stronger together in the fight against this pandemic. And I know how tough that fight is. Thankfully, there are early signs that the actions that we're taking are working. The rise in the number of cases is slowing and falling in some parts of the country, like London and Scotland. At the same time, the number of vaccinations is going up. Like many of you, I've been talking to members of my family who've just had the call to be vaccinated. It's a really emotional moment when people get vaccinated. It means so much to people because this vaccine brings safety to that individual and it marks the route out for us all from this pandemic. And I'm very proud to be able to tell you that as of last night, we have vaccinated 78.7% of all over 80s. That's almost 4 in 5 of everyone aged over 80. And I'm delighted that you can see from these figures that there's so much enthusiasm for vaccination amongst the over 80s, because octogenarians know what scientists know, which is that the vaccine saves lives. Of course, the rate-limiting factor to this vaccination program remains supply. As we know, supply is tight. We've had a very strong performance in this past week, and I'm confident that the NHS will be able to deliver every shot that's made available to it. To help with that, today we've opened a further 32 large-scale vaccination centres, including at Blackpool Winter Gardens, the Black Country Living Museum, better known to many as the set of Peaky Blinders, and London's Francis Crick Institute, which itself is no stranger to human ingenuity. And I'm determined to get vaccine take-up as high as possible. Today we're funding councils to enhance their vital efforts to engage those who are hardest to reach through our Community Champions scheme. As of today, 6.6 million have now received a vaccine against COVID-19. That's more than 1 in 9 of the adult population. On Saturday alone, we gave nearly 500,000 jabs. And in the last week, 2.5 million people have been vaccinated across the UK. That's a rate of more than 250 people a minute. We're on track to offer everyone in the top 4 priority groups a jab by the 15th of February. And if you are in one of those groups, one of the top 4 priority groups, and you haven't had the call yet, don't worry, the NHS will be in touch. It is a truly national effort, and alongside the GPs and the pharmacists and the other NHS staff, and of course the armed forces who are working so hard, alongside all of them working every weekend, every evening often, I particularly want to thank the 80,000 people who've stepped forward to help deliver this, doing things like volunteering to stand in car parks for 8 hours a day in the freezing cold to ensure that elderly people can safely get to the vaccination centre. It's truly heartwarming, and we've seen this selfless attitude towards the vaccination programme, and it makes me really proud, and I'm very, very grateful to all those who've stepped forward, because we know that the responsibility for the fight back against this disease rests on all of us. This is equally true when it comes to maintaining the rules and social distancing. Social distancing works by denying the vaccine the social contact that it needs to spread. And I want to reiterate an important point made by the chief medical officers and the clinical advice that they've been giving. Even if you've had the jab, the rules still apply. There's two reasons for this. First, because the protection takes time. Your body's immune system is only fully trained up around 3 weeks after your jab. And even if you have the protection yourself, we still don't know whether you'll be able to pass coronavirus on to someone else. We're monitoring that very carefully, and we'll publish information on it as soon as we have it available. So this is not a moment to ease up. The success of the vaccine rollout means we cannot put this progress at risk. The final thing I want to say is this. There is no question that the new variants have made this fight a whole lot tougher. And I want to set out again precisely what we know about the new variants. As with all science, as we have throughout this unprecedented crisis, we're learning more all of the time. And the new variant that was first discovered in Kent, which comprises now a significant number of our cases, it is spreading 30 to 70% more easily than the existing variants. And based on analysis conducted by academic colleagues in a variety of studies, there is a realistic possibility that this variant may be associated with increased mortality compared to the old variant, as well as increased transmission. And because of our extensive genomic sequencing, we've identified cases of the new variant first identified in South Africa and that one that was first identified in Brazil. And further scientific work is underway to understand more about these variants. But in the meantime, it reinforces the critical message that we must be cautious. For all of us, our response must be extra careful. Stay at home, maintain social distancing, and we've all, frankly, sacrificed too much. And it's so important that we protect lives, and we're making progress with the vaccine, and the end is in sight. We cannot put that progress at risk. And there's a promise of better days that lie ahead. We have to hold our nerve and persevere through this difficult winter. So it's incumbent on us all, wherever possible, to stay home, protect the NHS, and save lives.